Hello, sir. Sir, most of the people today are facing problems related to cartilage. What is this cartilage actually, sir?
So cartilage is a smooth kind of structure in between the two bones. Rather, it helps in the smooth movement of the two bones. That is called joint. The each end of the bone is covered by that layer that is called cartilage. So because of the cartilage only, joint function will be very smooth.
Okay, sir, the problems related to this cartilage, this problem is mostly faced by the people who are aged above 40, sir. Why is it so? Why is it so, sir? People who are facing only this problem above age 40. Why is this so? Sir?
Yeah. So of course you are saying that above is 40, but even below is also we are seeing nowadays. The first is obesity. Another thing is abnormal posture of the joint. Another thing is more usage of the joint and less physiotherapy or less caring of the joint. Another thing is genetic reasons. Next thing is high level of uric acid, faulty food habits, obesity, thyroid, rheumatoid arthritis, and some medications. They are causing structural changes in the cartilage.
Okay.
So that is leading to fissuring and breaks in the cartilage. That is leading to bad health of the cartilage. That is leading to arthritis. That is leading to other symptoms of arthritis.
Sir, as you said, the below people aged below 40 also facing this kind of issue. Mostly we see this kind of issue in the people who are into sports and all. Why is it so, sir?
Yeah, in the sports the reason is overusage.
Okay.
Because they have to practice 10 times to succeed one time. Okay, so in the short span of time they overusage. That is one reason. Another non-sports person is because of obesity.
Okay.
And faulty food habits and faulty posturing of the joint. So if the joint is at the problematic and if the patient is, if the person is very obese, they should not do some kind of activities like squatting, stair climbing, standing in one posture completely without moving, not doing physiotherapy, and all bad habits to the joints.
But for the obese people, usually at gym and all, they suggest high exercise. Usually they suggest high exercise. As you said, they shouldn't do more exercise like squatting and all. But they are all following all that kind of exercises. So what is the precaution for that, sir?
Yeah, so weight or lax muscles, improper joint health is not good for arthritis.
Okay.
If the joint is taking so much load, cartilage will worn away. So they have to do the exercises where the joint will not have any load. They are called open kinetic chain exercises. So entire weight should be on something and their joint should be free and they should be open to the air.
Might be yoga might help here.
Yeah, yoga, some exercises they are putting weight also. But simple understanding is static quadriceps exercise, bedside knee ROM, static cycling. These are the best exercises for joint health if they are diagnosed as arthritis. If there is no arthritis, if they are doing for muscle build-up and all those things, sweating and all those they can do. Once the osteoarthritis sets in, they are prone for osteoarthritis. I advise them not to do all these kind of activities like squatting, stair climbing, sitting on the ground and all those things. Cycling is the best exercise for osteoarthritis.
Okay. Any food that you suggest for these people, sir, like who are facing with this problem?
Homemade food, seasonal fruits, fresh leafy vegetables are always good. So to combat osteoarthritis, the available kitchen material like ginger, jaggery, and turmeric, they have anti-aging property or antioxidant property, anti-degeneration property. Nowadays, these things are coming in the medicines also.
Okay.
So turmeric will have curcumin. Okay, ginger will have antioxidant properties. Even in green teas also, the people are mixing all these kind of things to combat the stress.
Okay. Sir, for the people whose work involves standing for almost like 8 to 9 hours, what are the problems that they might face or they are facing now, sir?
Yeah. See, people who work as security guards or watchmen or traffic police, they have to stand in one place without moving to take care of their activities. While doing so, we lock the knee. That means the patella will be pushed to the backbone, that is called femur bone, because of which patellofemoral stresses will increase. Ultimately they will end up in cartilage damage of the either femur bone or the patella bone. That is called chondromalacia patella. If they are doing so, that problem will increase. I suggest them not to stand in one place, in between take stretch breaks, do some kind of knee movements, and do activities. Then only the cartilage health will be very good.
And for the people whose job involves like sitting 8 to 10 hours, for example, software related jobs, for them also there might be problems related to...
Definitely, because of sitting in one place, the first problem we are going to get is obesity. Next problem is stress. Stress will lead to so many kind of things. So in between an hour or so, half an hour or so, 2 hours or so, depending upon their work schedule, if they get up and do at least a minute of walking to ease the joints, to allow the synovial fluid to come in between the joints, in between the two cartilages. The cartilage will get nutrition, the sponginess of the cartilage will be maintained, joint health will be maintained. At least in those 2 minutes or 3 minutes walking, their brain will be diverted to some other thing. It will be active. That will help them professionally also, and the stress will come down. Some losing of calories also will happen. They can have one more coffee.
Sir, are there kind of reversible, or is there a complete cure for these problems?
No, we cannot say complete cure actually. The arthritis, if it is primary, that means age related. If as the age doesn't go back, arthritis doesn't go back. Okay. But we can maintain the health of the cartilage by doing this plasma therapy or regenerative medicine, orthobiologics. The plasma therapy is a very simple kind of thing, taking platelets from the patient's own blood by doing a process called centrifugation and injecting into the joint if the joint is having stage 2 or stage 3 osteoarthritis. Stage 1 joints will be very healthy. Some simple lifestyle modifications, physiotherapy and all those things will help. Stage 2, stage 3, plasma therapy will help. Stage 4, severe stage of osteoarthritis, plasma therapy is not going to help, and plasma therapy cannot be an alternative to joint replacement. If they want to postpone joint replacement for some days, the anti-inflammatory property of the platelets can be used. The pain will come down. They can do some kind of physiotherapy, 2 months, 3 months or 6 months. They can buy time to go for the joint replacement. But in stage 4, plasma therapy cannot be used as an alternative to joint replacement. Even today, the standard treatment for stage 4 osteoarthritis is joint replacement only. But the technique will be different. In our hospital, we are doing muscle sparing technology. That means, so joint replacement we do after cutting the skin, after cutting the muscle, we cut the bone, we put the implant, we stitch back and we come out. But the most painful thing after a joint replacement, what people say as is physiotherapy. For physiotherapy, what we need, the health of the muscle is very important. If we cut the muscle, definitely it will be painful. So we have looked into the literature and we have found a technology called muscle sparing technology, where we go to the origin of the muscle, we just separate it, we just distract it and we do surgery and we put the muscle back without cutting it. So the biomechanics of the joint is restored. The muscle will cooperate for physiotherapy. Patient can stand and walk on the same day with this technology. Before some even Hollywood actors also have gone through this technology. That is called quadriceps sparing technology. That this was in vogue 12 years before, but that time the instrumentation and the technique was not so evolved, so joint visualization was less. Some implant malfunctioning or implant malpositioning was there. Nowadays minimally invasive techniques have come, robo has come. So with the small incision we can see the entire joint. That is why now this muscle sparing technology is coming into vogue. Because we are not cutting the muscle, patient will not have any pain coming from the muscle.
Okay.
Okay, at least 40 to 50% of the pain will come down. The function will be restored very early. Patient can get back to his normal activity very early. He can do physiotherapy very nicely. That is called muscle sparing technology of the TKR. That is the latest trend now we are doing in our hospital.
Okay, at V9 hospitals. Okay, great, sir. Sir, this problem, this arthritis, is mostly seen in women than men. Why is it so, sir?
It's a part of aging. As they are menstruating, their menstrual cycles are regular. So estrogen hormone will protect them. Okay, as they are aging, the estrogen level will come down. They are going to menopause. Menopause will lead to all kind of these things. Whenever the protection is not there, the defense mechanism will go off and they'll get all problems. The another thing is who are undergoing early hysterectomy, they'll become obese. And even post-menopausal age also they will become obese. So because of obesity, joint health will be lost. Because of loss of estrogen, joint health will be lost. They will set up in osteoarthritis very early.
So regular exercises like how many days in a week they should walk or run
So some 20 to 30 minutes, 5 days in a week should be fine for early stage osteoarthritis. If the advanced stage osteoarthritis, I don't suggest them to go for a running, jogging, like hard activities. Swimming is the best exercise. Static cycling is the best exercise. Bedside knee ROM, okay, and all those things are very good exercises. How much ever their joint permits.
Okay.
How much ever their pain permits, that much walking only they should do. They should not feel that over walking or over exercise will improve the cartilage, will lead to good kind of physiotherapy and all those things. Absolutely bad idea. If their pain permits 1.5 kilometers of walking daily, that much only they should do.
Okay.
If the pain permits half a kilometer, that much only they should do. So if they have time to do physiotherapy, if they have time to do exercises, they can do swimming or cycling or bedside knee or static quadriceps. So they will not put any weight on the joint. Joint health will be improved.
Okay. So usually people say that like eating non-veg or bone soup kind of help in improving the cartilage. Is that so, sir?
Absolutely not. Absolutely not. If a person of bald hair person, if they eat hair, the hair doesn't come. No. So if they eat so much of food where the food is rich in cartilage, they will get cartilage. Is absolutely bad idea.
Okay. Okay. Thank you. Thank you so much, sir.